The one word that I always hold on to during my battle with cancer is courage, because it takes a lot of courage to make life-changing decisions.
One word that has carried me throughout this whole treatment will be fighter. A fighter who crosses all barriers.
It is with fight and courage that these ladies make their way through the fourth most common cancer in women, ovarian cancer. This scene is a familiar one to Nellie. For 6 months, going to see the doctor was part of her everyday life. She had a 10 cm tumor overlapping her right ovary. The diagnosis? Stage 3 ovarian cancer. There are many subtypes of ovarian cancer. The most common type is epithelial ovarian cancer, the same one that Nellie had to fight. This kind of cancer comprises about 90% of all ovarian cancers.
3 times in a day, is it?
One word that I always keep in mind when I see patients with cancer is hope, to know that they still have a lot to live for. For epithelial ovarian cancer, most of these patients are, they are a bit older. Sometimes they can be in their 50s, in their 60s. They completed a family. And so fertility is usually not an issue here. And for these patients, we have to operate, we have to go in and remove the uterus, remove the ovaries, and as much of the cancer as we can see, so that she can respond better to chemotherapy after the surgery.
And this was the case with Nellie. Doctors advised immediate surgery, a total hysterectomy with removal of the ovaries. The side effects of such a surgery, if the patient is at a premenopausal age, is they will become menopausal, which means they will have symptoms like hot flushes, night sweats, insomnia and mood swings. At 45 years old, after having surgery to remove the 10 cm tumor, these are side effects that Nellie is familiar with.
I have learned to cope it. Initially, it was a bit of a struggle for me. Some of the adjustment that I have to make is, of course, I have to go through my day with this hot flushing thing, changing the kind of clothing that I've been putting on, making it more comfortable, more light, so that it's more bearable for me. I've stopped wearing covered shoes. I've switched it all to open-toe shoes. It's not a big issue. They're also pretty open-toe shoes with heels, You just look for it, go and buy it.
Besides surgery, Nellie has gone through 6 cycles of chemotherapy. The good news is that her condition is now under remission and she is free from any kind of treatment. 10 months after given the all clear and with encouragement from her husband George, she quit her job at a bank. Nellie wanted to do something that she has passion for, and now she owns 2 childcare centers. Come Tuesday and Thursday every week, rain or shine, this group of ladies will come together to do their marketing. And breakfast is a must. All of them are mothers with similar interests. The only difference is for Sylvia, pills go with her meal. She is under oral chemotherapy, part of her treatment for ovarian cancer. Chemotherapy is given after surgery to reduce the risk of circulating ovarian cancer cells from settling down. That helps to reduce recurrence and improves their survival.
The one word that I keep with me when I'm treating patients is always the word joy. I think that no matter how short, how long a life is, it's not life without joy. 90% of our patients come into our clinic with a pre-existing misconception about chemotherapy. They always picture themselves having absolutely no hair, having mouth ulcers, vomiting and running to the toilet almost every hour. This is actually a very negative picture of patients on chemotherapy. True. Perhaps maybe about 1 to 2% of our patients may experience such severe side effects, and these patients tend to be on very high dose chemotherapy. But in general, nowadays we have very good medications to try and reduce that. So I would have to say that more than 90 to 95% of our patients feel that chemotherapy is actually much better than they thought it would be.
And the straight best way to break the contacts. Sure.
Sylvia is a mother of 3 boys. Her youngest son was only 9 when she was diagnosed with epithelial ovarian cancer. Since the surgery 4 years ago, she has gone for 5 rounds of chemotherapy. The side effects of the 4th round of chemotherapy were particularly bad.
You just feel very short-tempered. Even the smell of garlic makes you want to scold people, lose your temper. And I do get headaches. Sometimes you just feel like banging yourself against the wall. It's very frustrating when the side effects are in full swing against you.
Though giving up during the treatment did cross her mind, Sylvia had her reasons for persevering.
For that hope to live, to be able to control the tumor growth, I think it's a price that you want to pay for that opportunity to live. To me, that is, and I think more important is that I respond to the drug. To me, it's bearable. It's bearable.
Sylvia is now in her 6th round of treatment. She has practical ways she uses to deal with difficult days.
When I have loss of appetite and I couldn't eat, but I know that I have to eat because I need the nutrients, what I'll do is that I'll serve food blocks that I know of, and I'll just carry my bowl of rice with the whatever that's inside and then look at the food blocks and pretend that I'm eating that particular one, is to stimulate my appetite, and I find that helps.
I started feeling bloaty, for about a month, and then I was also feeling very fatigued. So I realized that that's not normal, because when I go to the gym, when I do my normal running, it's very unusual for me to be feeling very, very tired.
Actually, I also felt that there was this tightening of my shorts or my pants when I wear them. I didn't know that was also one of the symptoms. To me, it's just very normal that you put on weight at the tummy, especially at my age. I had some nagging pain on the right-hand side of my abdomen. At first, I thought it was appendicitis.
In both Nellie and Sylvia, the period before they were diagnosed with ovarian cancer, there were no out-of-the-ordinary symptoms. This is what makes it difficult to detect ovarian cancer at an early stage. Therefore, it's important to be alert to symptoms that may seem ordinary but persist, and then a visit to the gynecologist is encouraged.
There are methods to screen for ovarian cancer. Unfortunately, they are not very accurate at the present moment. They will consist of 3 things: physical examination, doing an ultrasound scan of the pelvis, then doing some blood tests. The whole purpose of screening is to pick up early ovarian cancer when a patient doesn't have any symptoms. If you catch it early, I think we can do something about it.
One thought that I can get through this is never give up.
Kelly, 18 years old, A-level student, loves shopping, music, movies, and hanging out with friends. Diagnosed with ovarian cancer. About 5% of ovarian cancers are called germ cell ovarian cancers, which usually affect younger women.
I feel my stomach getting bigger, and then it's hard when you press it, like inside there's a stone. And then I was changing my size of my skirt, adding about 5 centimeters. Because I don't think anything serious will happen to me like cancer or tumor, so I decided. didn't go to the doctor at the first time.
But her condition was serious. Her stomach had grown to the size of a woman who was 7 months pregnant. This was typical of germ cell tumors, which have rapid doubling times.
One word I always have in my mind is encourage the patient to go through the whole treatment. When the patient comes to visit me in the clinic, the mother has told me only that she has a big tummy. So, however, she is quite okay. She speaks all right. She is not breathless, and she can move around normally. She also didn't bother that the tummy has been enlarged. That was my surprise. And that's why she also didn't tell her mother. That's why I think has been kept so long. Otherwise, we would have detected much more earlier.
The earlier such cancer is detected, the shorter the treatment could be. Kelly was advised to go for surgery immediately, but the surgery was not what worried her most.
My biggest fear was that I cannot go to school anymore and that I cannot get along with my friends and my family. I think school is for my future. If I didn't go to school, how's my future gonna be?
However, the immediate future for Kelly was to be free from cancer. Her biopsy showed that the tumor was on one side of her ovary. The inside of the other ovary was still intact. Therefore, only her right side of the ovary was taken out.
The germ cell cancer is derived from the ovary. Many women are thinking that they will immediately lose the reproductive system. However, the ovary is two sides, right and left. The cancer can be only on the one side and you still can preserve the other side. That is the misconception, because people still can alive or can give birth, can pregnant with the one ovary.
The good news is that germ cell tumor has a 90% cure rate even at the late stages with conservative surgery and adjuvant chemotherapy. After the surgery, Kelly was sent for chemotherapy.
The first time I was shocked and I didn't want to do the chemo because what I was seeing in the TV, chemo is scary and makes people cry and sick of it.
Going through the effects of chemotherapy was a concern. However, the question that was upmost in her mind was her ability to menstruate again.
In actual fact, many patients, while they're on chemotherapy, actually retain their ability to have periods, and they continue to do so throughout the entire course of chemotherapy. Even with a young lady who stops her period during chemotherapy, the periods would return 90% of the time within 1 year. That would mean that the ovarian function recovers even when they only have one ovary left. That also therefore means that it's compatible with future fertility.
After I did chemo, it's not as bad as things before, but it's just different in a good way.
Her menses did come back. Kelly's treatment was finished in 4 months. Her fears of not being able to continue her studies were unfounded. She is now in university, specializing in fashion business.
When I did the treatment, I have to stop my usual life because I have to do the chemo. But after the 4 months, after I done the chemo, my life back to normal, and now I'm ready to live my life again.
Recurrence, I think, is in the back of my mind all the time. It's just like a kid going for exams, you know, you get your report books, you're worried that you fail.
In advanced ovarian cancer, despite good surgery and chemotherapy, up to 60% of women could still suffer a relapse. However, the recurrence rate depends very much on the stage of the disease.
20 to 30 years ago, there probably had been only 3 to 4 different chemotherapy drugs that were available for the treatment of ovarian cancer, whether early or advanced. But with each year that goes on, newer chemotherapy drugs get discovered or even get designed in clinical labs. With newer drugs that are available with better surgical techniques, many of our patients who suffer a relapse still have a second chance and even a third chance at second or third remission.
And that is the hope that Sylvia and her husband Andrew have, even though the cancer has come back for the 6th time. And this hope is what he carries with him all the time in his wallet.
He kept a list of all the drugs available, for me. Each time he will be the one to ask the doctor whether this drug is effective for me, or maybe is it to be used with another drug. He will be the one who asks the questions. So that list to him is like a checklist whether I've tried that a particular drug or not. And he will go down the list, and when I have tried all the drugs on the list, he would ask the doctor, okay, what new drugs do you have now that my wife can try? I'm not alone in this fight. He told me not to worry, and just to have that fighting spirit to carry on cherishing the hope that one of these drugs will work for me.
Not fighting the battle alone was the one thing that Nellie and George had on their minds from day one. Their game plan? A blog for Nellie to share her experience so other cancer patients would know what to expect. And know that they were not alone either.
From the very beginning, we said to ourselves, this is something that must be faced totally, 100%. If you look at a relatively young woman like her at basically 42 years old when she came to know about this, there's so much ahead of her, so much life, so much hope. We just took it upon ourselves that this is not the time nor the place to feel defeated in any way. We said we were going to fight it, to the very last ounce of our energy. So that was what we did.
Nellie has been in remission for the past 2 years. What does the reality of reoccurrence mean to her?
Yes, that's also been confirmed by the doc that there's a high chance of recurrence for ovarian cancer. But honestly speaking, it has never occurred in my mind. Because to me, if it happens, it happens. And just like when I got first hit with cancer, nobody expected it. It happened. So I fight it. So if a relapse were to happen, likewise, I would just fight my way through. And with a lot of advanced medication these days, I think it helps.
150 kids. And for the one that is off treatment, these are 150 reasons more why she is living life with fervor. And for the one who is still on treatment, there is no difference.
I always feel that life goes on. The world will not stop spinning just because you're sick. I feel that I want to get on with my life. By hanging out with my friends, I find that they encourage me a lot. I enjoy being with people. I don't want to be cooped up in the house, facing the four walls, wallowing in self-pity, thinking to myself, oh, this is the end for me. I feel that it's not that you're not sick. It's just that life does goes on, and you want to be part of that life, however short or however long it is. These are the things that I do before I was sick, like going marketing, going grocery shopping, cooking, eating, things that a homemaker does. And just because you're sick, that doesn't stop me from doing all this.
The 5-year survival rate for ovarian cancer has increased from less than 30% to more than 50% in the last 10 years. There is hope yet.
If hope was a color, it would be yellow, because yellow symbolizes the sun, a brand new hope to live for another brand new day.
Because yellow is the royal color, so it means that there is a hope for everyone.
Because yellow and orange is bright, so draw my future that's gonna be bright.
If hope's a color, it has to be green because green signifies plants, and if there are plants, there's life.
It would be red because red is heart, red is happiness, red is blood, and everybody needs blood to live.
Blue, because it represents a deep blue sea and it provides plenty of life in the future generations.
I would say blue. I look at the sky, look at the wide expanse of the sky, everything seems possible.
And as Nellie and Sylvia have shown us, the true color of hope is life.